it's Megan. I just wanted to review some of the things that we talked about today in seminar. So let's pull up some of our UCN Learn news that I've posted here. A1C quiz results. So I was wrong. I said it was 6.5 today, but it should be less than 6. So 6.5, anything over that, we would diagnose you with diabetes. But when you're normal and you don't have diabetes, your hemoglobin A1C needs to be less than 6. So thanks, Kelsey, for pointing that out. I want you guys to keep going with the 6 that Bijou has given you on your lab values. Don't worry, if you guys have crossed it off and put 6.5 on there, I will reprint it, I'll bring it for you, okay? So I'll bring it to our lab next week. But we got a good, nice score on our quiz results. Check it out, 85%. Awesome. I'm going to review the quiz now. Okay, I've pulled up question 1. We are the nurse. We are monitoring a person with type 1 diabetes. The statement that they would make that makes us suspect hypoglycemia, everybody got it right. I can't stop shaking. We're talking about that adrenaline release, right? Fight or flight kicks in. That's what we're talking about here. That's what the shaking is. Not that we have to go to the bathroom. That's hyperglycemia. Not that they have to throw up. That's hyperglycemia. Please, can you get me more water? Also hyperglycemia. So great job, everyone. Question number 2. The nurse is caring for a patient with type 1 diabetes. In addition to frequent blood sugar checks, what are we going to expect this patient to require? Everybody got it right. Daily administration of insulin. Yes, probably if they're in hospital, they're also getting blood sugar or blood pressure checks. No, they're definitely not getting oral antidiabetics because that's only for type 2. And we're probably not doing a daily urinalysis either unless there's a reason to. So great job, everyone. Question 3. You are the nurse caring for a client who's been diagnosed with DKA. What do you expect to include in the initial care? See how I bolded initial? That means what are we doing first? And that is administration of normal saline. Let me pull up the slide here. So when we take a look at the slide, this is directly from our notes. The first thing we do, ABCs, obviously, if they're not breathing well, we need to give O2. Then we do fluid resuscitation, IV normal saline, because we know they're dehydrated, right? They have gone so far into DKA, they don't have any fluid left. They peed everything out along with all their electrolytes. So we're going to give them IV normal saline. We need to restore their output 30 to 60, okay, and maintain their BP. Then we're going to give them potassium because we know as soon as we give insulin, the potassium is going to go right into the cell that they have left, and there's been a profound loss of potassium because they've been diuresing and peeing it all out. And after we do fluid resuscitation, that's when we start IV insulin. So a lot of you guys chose insulin, administration of IV insulin, but no, we're not going to do that until after we have this person rehydrated. So the right answer is IV administration of normal saline. Question number 4. The nurse is teaching a patient about insulin administration. The patient asks, why do I need to know the peak timing of my insulin and what is the best response? So all of these things are probably true, but the best and the most important one is that the risk of hypoglycemia is greatest during the peak of insulin. So if we think about our rapid acting insulins, we know they start to work within 15 minutes, but they don't reach a peak until 60 to 90 minutes. So that's the time when they're at their highest, and that's the time we may get hypoglycemia. So our patients need to know when the peak is of their insulin so they can be prepared. So if they eat and they eat a small meal and then an hour to 90 minutes later they notice they are having symptoms of hypoglycemia, it's because of the peak of their insulin. So they need to know that and treat themselves for that. Yes, they need to know when their next injection is, but they're not going to base that on the peak times of their insulin. They're going to base that on like how long their insulin lasts altogether. It's not going to help them know when to check their blood sugars. They're going to check their blood sugar before they give insulin. Give insulin and then check it the next time before they give insulin, or they could check their blood sugar again if they were feeling hyperglycemic. But we're not going to check our blood sugar at the peak time. We do it before. Or because it will help you plan your activity level. That might be true, but it's not the best answer, right? They need to know they're at risk for hypoglycemia during the peak. When you're reviewing and when you're studying for exams, for tests, and you're reviewing diabetes, make sure you know the difference between type 1 and type 2. Make sure you know the medications that we're using. Make sure you understand insulin and how it works. Hopefully our game today helped you with that. And make sure you review things like DKA and HHS. All right? Great job this week. See you next time.